Welcome to the Sustainable Dish Podcast. I'm Diana Rogers, a real food registered dietitian, author, and sustainability advocate. I co-host this podcast with James Connolly, who was a producer on my film, Sacred Cow. I also founded the Global Food Justice Alliance, an initiative advocating for the inclusion of animal source foods like meat, dairy, and eggs for a more nutritious, sustainable, and equitable worldwide food system. You can check it out and join me at globalfoodjustice.org. Thanks again for listening, and now on to our show. Welcome back to the Sustainable Dish Podcast. Today I have with me Trisha Rayner from the Freestore Foodbank, and I actually just got back a couple weeks ago. I was there with you. We were handing out some meat sticks, so it's great to have you on the podcast, Trisha.
Thanks for having me, Dan. It was great to see you and get to know a little bit more about you personally and also a lot of the work that you do. So appreciate you having me on today.
Yeah, and so for the folks who are listening who didn't catch the news that I was out there, how I got connected with Trisha is that the NFL has a program called My Cause, My Cleats. And Cincinnati's Bengals player, Markus Bailey, reached out to me. He saw me engaging in kind of a social media exchange, actually, with a dietitian he knows. And we were kind of back and forth about something a little bit heated. And he was like, really into what my position was. And so he started looking around, realized I had a nonprofit, reached out to me, said that, he's been in the NFL for a couple of years and never really participated in the My Cause, My Cleats because there just wasn't a cause that he felt super passionate about. But once he saw the Global Food Justice Alliance, he knew that that was something that he wanted to get behind. So he and I had a call and asked me what we did. And I said, well, we educate people on the importance of animal source foods. And he said, great, great, great. But do you do anything? Like, do you, do you actually get meat into people's hands? And I said, well, I think that's a great idea. Let's make that happen. And so we came up with the $1 buys a meat stick for a kid. And he also was pretty passionate that this donation happened not just to any random location, but in Cincinnati, in his hometown. And so that's how we got connected with you, because you run the Freestore Foodbank in Cincinnati. So that's the backstory on how we got connected. And I had a great call with you and found out that you are also trained as a registered dietitian. So I'm so excited to have a dietitian that works in the food insecurity space. It's something that I am so passionate about, and I'd love to, just talk about that, like how you see the role of dietitians in food insecurity, what led you to, first become a dietitian and then also, start working at the food bank.
Sure. Well, again, thanks for having me on. And I said, all the stars aligned with you and Marcus having that great conversation, and certainly appreciate, him being from the area and growing up around here, his investment in the kids and families that are just in his backyard. So we couldn't be more proud to have a local kid, young man join us in that journey. It certainly goes a long way. So I thank you for helping raise the awareness of that work that you do globally, here locally with someone that's very passionate about it, and you can tell that he is. So of course he's on that life journey of wellness as well as we all are. And he certainly is kind of in the spotlight for that, as he has to keep his body healthy for the work that he does. And so, with the backgrounds that we have, we want all people to have access to healthy, nutritious, sustainable food. And certainly that includes, recommendations from My Plate and the USDA. But many people are always short on that protein part of it, and kind of talk more about the fresh and healthy vegetables, fruits and vegetables, which of course we want people to have. So, from that perspective, being in the community health space, I think it's always important to talk about balance first, how we get food into people's hands and access, and then talk about how we can make it in the most nutritious way possible. So we certainly want to make sure access and food is available to all people. There's no reason in the United States that that doesn't happen in every corner of the US. But we also want to make sure it's nutritious. The food that people eat impacts community health. And so, following some of those health indicators is also important to pay attention to make sure that we are building healthy communities. And certainly, there's disparity in that as well across the country and locally that we need to pay attention to as well. So, there's lots of things that are wrapped up into that conversation, I'm sure. But um, as part of my journey, I've always been interested in health and nutrition. I said I grew up a child of two teachers, and so education has always been extremely important to the work that I do. And then just found my passion in nutrition and dietetics when I was in college. So followed that up with an MPA with a concentration in community health, and I've always been able to work in that space and look really weave it into the work that I do with policy action items, with working with long term outcomes for community health, and also just day to day service of how do we actually get this done. So there's a continuum of that, as you very well know, is what happens now and how can we make sure that we make an impact immediately? And then what are some of those longer term outcomes that we need to think about in communities? And how does that affect some of the work that we need to do from an advocacy perspective and a policy perspective? Because some of those long-term strategies just take a lot of work to do. And I think that that's important for that everybody can not only get engaged on using their hands to help immediately, but also think about how you can influence others to be on that journey with you. So I know you work in that space a lot to help not only just do the work, but also advocate on behalf of others and advocate for the right choices, not just what's convenient.
Yeah, and we're seeing we get there's so much attention paid to fresh fruits and vegetables, and here in Massachusetts, a few years ago, I did a podcast with a farmer who is a raises local meat year round
Mhm,
and participates in year round farmers markets here, and was feeling really frustrated because there was an incentive program where people could get double their money on only fruits and vegetables.
mhm,
And so the $6 pint of organic raspberries and the $12 bag of organic salad mix, they could get, they got double their money on. But then here she was with much more nutrient dense food, which was liver, ground meat, locally raised year round. Massachusetts, you can't grow raspberries and salad mix year round.
no,
And they're lovely things, but they're not going to fill people's bellies who are hungry. And
yep,
they do not have the nutrient density. But somehow, I saw this in my training, I'm sure you did too. There's this halo over
yep,
raspberries and salad mix that
mhm,
meat doesn't have. And it's really unfortunate, and especially when we're talking about hunger and malnutrition.
mhm,
The top nutrient deficiencies in the US, iron
mhm,
among the top,
yep,
B12. I mean, they're all found best or only in animal source foods. Will
mhm.
you talk a little bit more about that kind of thing that you're seeing with your
Ye
work?
Absolutely, and certainly I think when we talk about, kids and families and those that are food insecure, we do talk about nutrient-dense food and food that lasts for a while. Um, th those, and not just in your stomach, but also from a shelf life
Yeah,
perspective
I mean,
too.
yeah, you're that's a good point that I didn't even bring up, but I mean, anyone who's bought raspberries or salad mix, I mean, salad mix lasts a little bit longer than raspberries, but those raspberries are gonna go bad really fast.
Yeah. So if you're like any of the rest of us that buy those things and we buy them frequently, you know exactly how many days you have before it goes into the freezer that turns into the smoothie that you have to have. So
Right.
you can smoothie yourself to death with it, which was unfortunately what I do to my family too, is if you're just not eating it quickly enough, we certainly want people to have a variety of foods with vitamins and minerals that will sustain them. Um, but we also have to talk about cost too. There's cost associated, especially with protein items, that has made people shy away from that as well. So during the pandemic, it was certainly very prevalent that we saw those meat prices go extremely high. We see it in seniors who are making choices between getting something that is I don't know, shelf stable versus can you throw your meat in the freezer and then divvy it up into portions that are good for you? So we
Yeah, I
certainly
mean, the
see that.
reality is
Yeah.
definitely a box of pasta or a mac and cheese or something that's,
Yep.
more of a staple food
Mhm.
is cheaper,
Cheaper.
and people
Absolutely.
aren't realizing that there's a huge nutrition trade-off with that.
Absolutely, and certainly, when you talk about feeding America across the country, we're part of that network. And in our area, we have 20 counties. We have about 600 partner agencies, which are, schools and clinics and, you know, local churches, soup kitchens. The number one requested item is always protein across the board. And it has to do with cost and it has to do with storage of it as well. So it has to be safely stored. Over the last, if you have seen the last 10 years at least, a lot of meat is able to be ready to eat meat, which is extremely helpful that food insecure people and those that are not, do not have as much income, they have storage issues, cooking issues. We know that there are temperature issues, and that needs to play into the safety part of it. But there's also that cost piece that again is it prohibits people from purchasing those items, and it's stocking up on the cheaper items. So it's trying to find a balance for that and trying to identify other areas of protein that we can infuse into the work that we do and make that more prevalent and available for people who are choosing to go cheaper versus more nutrient dense meat products, which I think is important for them too. But we see it a lot in seniors. And as you mentioned before, it's certainly those deficiencies that we see across the country in B12 and iron and those things, which can only come from protein sources. So again, it's a community health perspective as much as it is anything else. It's access and it's nutrient dense foods, so we can build healthy communities um, across the country.
Yeah, because when someone ends up with type 2 diabetes from eating these less expensive, packaged foods, that's gonna cost society as well.
Absolutely, absolutely.
Yeah. When we were, starting my film, Sacred Cow, we actually, the first all the stuff that ended up on the cutting room floor, just because it was such a complicated story, we were following some patients of Dr. Hallberg
Mm,
in,
yeah,
the professor at Purdue
yeah.
who also and so she was putting all these people on a ketogenic diet, trying to reverse their type 2 diabetes, and the reason we couldn't use any of that footage in the film was because it wasn't just about following a low carb diet, it was about the problems that people faced. We had one young man, he lost 60 pounds following a ketogenic diet, but he couldn't afford school lunch. But the lunch that was provided was so high in carb and so low in protein
Mhm.
that it didn't work for him. And so he was having to, find just sausages, that were shelf stable to bring to school. We
Yep.
had another woman who was disabled and a senior who was trying to do keto at a food bank, and we actually filmed her at a food bank trying to in her
Mhm.
mobile chair navigating the aisles, trying to find that protein. And the reality is a lot of this food bank did have a freezer
Mhm.
and did have some meat, but
Mhm.
it was just a huge challenge for her. And
Yeah.
so we just didn't feel like we could tell that story on top of regenerative agriculture and
Sure.
ethics and all
Sure.
those things
Sure.
because following being able to have access to protein is a huge privilege that a lot of people don't have.
Yeah, and certainly some of those shelf-stable protein items are critically important. And I would say that from a youth perspective too, is
Mm.
that should be part of the package and part of the staple. Um, you know, I think when you're here, we were talking about one of the schools that we kids jump on the bus system in the morning, so they're leaving their homes at 6 o'clock, and we're talking public transportation, not busing as in the school bus. They're there during the whole school day. They have academics, they have basketball practice, whatever that may be afterwards, and then taking the city bus home. So they could be at school for 12 hours. So one of our pantries is in there, and certainly they pay very much attention to what's that sustainable piece to get kids in a 12-hour period that can make it through the day, and the availability to take groceries home with them for their family. So I would say in that one, which is always an interesting study, is it is 100% graduation. It's 100% placement of kids going to college after that. That they pay very much attention to what is available for kids that is healthy and nutritious. It's not just filling the shelf. And you know this too, as you look at some of our protein bars and other things that you go and get for your own children, and you have to pay attention to that, to the items that are on there, because you're adding more carbs, more sugar, more additives to those types of things that typically have been seen as popular items to put in a backpack or a snack pack. So it's trying to find the balance of education, and then access as well. So you know that's just for any family that's looking for those. Not And then think about on top of it is those that can't afford to have those options or even have access to those items. So food banks look at those grocery gaps and where we can infuse items, and looking at how they're culturally appropriate in some of the communities too. And so we try to find that balance. We're not always great at it, as we all are a work in progress, but you have to think about culturally appropriate foods in pockets of our community too, and provide access to healthy, nutritious foods and proteins in those communities as well. So um, it is a difficult thing to do, but it's certainly always on the top of our mind when we talk about food insecurity in our community. Is it's not just any food. We want to make sure that that food is, again, healthy, nutritious, and well balanced for someone who may not have access to other sources of food.
Yeah, I mean, this is what's so frustrating to me and why I've written so many public letters, especially to New York Mayor Eric Adams, who has not only, they walked into the New York City public schools with meatless Mondays and then instituted vegan Fridays. And a lot of people, pushed back at me saying, what's wrong with some salad on Mondays? But that's not my problem. I don't,
Yeah,
it's not about having a little more salad on Mondays. It's about the message that these kids are getting that meat is not okay. And it's about the fact that 70% of the kids that go to New York City public schools are either, low income or homeless.
hmm,
So they're going home to food insecure environments.
yeah,
And now we're flanking the school day, which is the whole point of the school lunch program, is to provide nutrition. We're flanking it with less nutritious items because it just can't be as nutritious. It's just not possible if you remove the meat to
yeah,
have the same level of nutrition. And then when we tell these kids that meat is not okay, you think of a typical urban kid, right? Their favorite foods, what are they? Hamburgers, deli sandwiches,
yep,
mac and cheese, hot dogs. So when you tell them meat is bad, it's not like they're going to go get a $20 quinoa bowl with
yeah,
edamame and
yeah, yeah,
and extra chickpeas on it. They're
yeah,
just going to go get a sandwich with no meat, or something, or just the fries and a Coke and maybe not the burger, which,
yeah.
if you look at the whole landscape of their favorite foods, that burger patty
Is the
is
best. It's the best option of the
of
package
all
that
of
you
that.
get of the. Absolutely, absolutely. And so I think it's, again, it's variety of that too. Is there's sources of protein that are certainly better than others. Um, and so how do you kind of find it that balance too? Is I'm not sure the general public. I mean, the meatless Monday message has been going on for years.
Mhm.
It's been going on for years in school districts and health departments. And again, not that we're saying fruits and vegetables are bad, because they certainly are part of a well-rounded diet, but again, it's that message of the protein. I was just thinking of the story that I worked for the YMCA for about 10 years, 10 or 12 years. And so worked with the Robert Wood Johnson Foundation and some community health policy projects. And also obviously health and wellness and fitness. And I was actually out in Boston at the Cybex headquarters, where they make machines, um, for large, of course, fitness.
Cybex, like
Cybex,
those
yeah,
gym
the Cybex
machines.
ARC trainers, and yes.
Yeah, yeah,
So
yeah.
a
Okay.
good friend of mine is locally here, and he was the sales rep for this half of the country. So took us out there. You watch them being made and new models, and of course, um, and the PhD that was in the lab testing people on these types of machine. We were just talking in general about movement and muscle, and certainly you need protein for muscle. And he said muscle is one of the largest predictors of how long you can live in your home as you age. Grip strength, muscle strength will keep you in your home longer as you age. Not saying you had to be a bodybuilder, not saying that you had to be um, super fit. It was muscular strength and grip strength of those muscles help you catch yourself when you fall, right? Help you reach for things and help you do the daily activities that you do. And I said I found that so fascinating, and I tell that story quite frequently, is because if you are not doing those things to address muscular strength and grip strength, don't we all want to live as long as possible in the home that we have? And what an interesting way to think about not being a marathon runner, not being again a super fit person. It's muscular strength and grip strength will keep you in your home longer as you age. And it always resonated with me about what that means for your diet and your activity in order for that to happen. It's not a competition, but it's just your own health that you need to pay attention to. So again, it kind of swings back to that protein piece of it is you have to have protein to build muscular strength.
Yeah, and, I think people, a meat stick for kids is certainly a compelling message, but when we think about seniors, um, like you just mentioned, the ability to digest protein declines as we
Yep.
age, and
Mhm.
so our need for protein actually increases much higher than the RDA, which is the minimum,
Yeah.
not the optimal level, the minimum level.
Mhm.
And it's not just about longevity; it's about health span, not lifespan. And
Yeah.
so,
Yeah.
making sure those seniors are getting it, and how many seniors, I mean, so many of them are low income and relying on, these messages. And, in addition to my frustration with Meatless Mondays and Vegan Fridays, is that now Healthcare Without Harm and the College for Lifestyle Medicine are working with Mayor Adams to offer vegan meals as the first main option in all New York hospitals. Which is so frustrating to me because, you probably worked in hospitals as part of your training.
Yeah.
I
Yeah.
did,
Yeah.
but protein needs are much more increased as we're
For
recovering from
recovery. Yeah.
something. And people listen to dietitian. That might be the first time they've ever met a dietitian is when they're
Mhm.
going to a hospital. And so
Yep.
to have a hospital endorsing a message that is anti meat is very disturbing to me.
Yes. And that recovery period is so important too, is you have to have those items and again, digestible items for that recovery period. And there are studies that say if you don't do that, your recovery period is longer. And we all know that health insurance companies have moved in a direction of we don't want people to go back to the hospital. We want them to be in there for a shortest period of time. We want to move them on into the next part of it. And their work as even insurance companies is for that recovery period to be one as quick as possible and safe and healthy, but to not have to have increased insurance premiums because you're not doing the things that you need to do to recover. So that's always tied into those pieces of the insurance business and the health care business
Yeah.
and certainly personal health.
So maybe my best bet is to reach out to the insurance companies who want to
Absolutely.
see people recover more quickly and
Yeah.
keep them off long-term
Yeah.
disability
Yeah.
and all of that, and just work
Yeah.
with them directly on making sure people get protein.
Absolutely. My sister's a nurse and she's worked for a large health insurance company and manages nurses across the Midwest. And nurses are virtual and they are calling people post-op and post-recovery to make sure that they're doing the things necessary so they don't go back into the hospital. And so insurance companies are paying more attention to than anybody is they want people to be healthy and not go back to the hospital. And I think hospitals don't want that either because that's how they're scored on their hospital rankings. They don't want that repeat hospital visit. So there has to be some strategy in there that benefits both of them, but also is the right messaging for an individual's health and well-being.
It's funny because actually, the second phase of the filming that we did for Sacred Cow, and maybe this needs to, evolve into this a new project, but we actually flew to Zurich, Switzerland, and met with Swiss Re, who is one of the largest
Oh yeah.
reinsurance companies. So they insure the insurance companies,
Hmm.
and they were curious what diet makes people live the longest so that we can keep people, paying their life insurance premiums the longest, right? So they had actually the purest goal of anybody
Yeah.
because
Yeah.
there was no dogma,
No.
and it turns out that a lowish carb, protein forward diet is
Yeah.
the way to go
Yeah.
for health
Yeah.
span. And it's just amazing that, when it trickles down into mainstream messages,
Yeah.
that's not what people are being told.
Absolutely. And I think it's just, everybody wants to be in that space, and it's very flooded with all kinds of messages about health and nutrition. So you have to really educate yourself, or else you're picking pieces and parts of what you want to hear and what you think is the right thing to do. And a lot of them are not from viable sources, and not from um, measured sources and backed sources. So all those messages coming at people, it is difficult. And I say, from a food bank perspective, you throw the inability to access it and afford it on top of that. And those are some hard decisions you have to make for a family. Um, and you have to kind of educate yourself on where you can go, what you need to do, and how you spend those resources. And I say that just because the SNAP benefit emergency allotment just expired March 1st. We had a senior come into our one of our markets, and he was, during the pandemic, receiving about 150 to $80 a month to support his SNAP benefits. That's $180 a month. With the emergency allotment going away, it was reduced to $28 a month.
Oh my goodness.
So he has to access us at this point to be able to just eat, and has
Mhm.
to know resources and the best way to spend what he can get. But $28 of SNAP dollars, $28 in SNAP benefits is not a lot of money for a senior to make those choices. So they're making the cheap and easy ones, right? They're making the, how many potatoes can I get? How many noodles can I get? Because it's the cheapest option. Price of eggs, throw that on top of it,
Right.
and the usual cost of protein is not affordable to someone getting $28 a month to help supplement an already small income. So it was kind of a perfect storm. We said on March 1st of, Social Security benefits went up about 6%. Emergency allotment came off of SNAP. So an increase, it was viewed as an increase in seniors and disabled, a 6% increase, which is the largest ever seen, as an income increase, which decreased their SNAP benefits on
Right.
top of the emergency allotment going away. And so we are tending to see more aged people coming into the food bank for that resource, because that just isn't enough to make it through.
Ugh, and that's just so frustrating. Ugh,
Yeah.
I was, oh, I was gonna bring up the fact too that, for WIC benefits, a lot of people don't know this, but there is no meat at all,
No.
offered on for WIC,
Yeah.
which is the women, infants, and children, which we know those first 1,000 days are the most important,
Absolutely.
setting these kids up for lifelong success or nutrient
Yeah.
deficiencies,
Brain development, all of the good
brain
stuff. Yeah.
development, eye development,
Yeah.
and physical development, right?
Yeah. And I would say that certainly we have several hospital clinics that are very interested in that work, especially our Cincinnati Children's Hospital. We have two clinic pantries there where social workers also interact with the medical staff and really surround the patient coming in. So it's kind of a one stop shop. Um, the hospitals certainly look at it as an added piece of their work that they do to help. Um, it's more beneficial to have it right there, so families don't have to take another bus stop, don't have to take another child. But also look at it as a way, and one of the, we've been doing this with Cincinnati Children since, gosh, July of 2017. And really what they measured too was, what repeat visits are we seeing because we have access to those food and we can provide access. So an
Uh,
ear infection at 3 months and you have to come back in 2 weeks, if you know that you can come and say, I just don't have enough food to make it through the week, it's right there at the hospital. So they looked at one of the measures of return visits on the health and wellness scale to say, if we have some of these options available and patients are not afraid to come in and say, I just need a little help getting some food, that was a great way for them to say, then they're coming back to have that child checked up from a previous illness or injury. And so it was changing a little bit of that stigma of, um, once we see a patient, then you never see them again. But you
Mm.
can actually help the entire family, not just the child that needs the visit. So, we make sure that we have healthy choices available in the hospital. And hospitals have regulations about what you can store and what you can't store. And shelf stable protein's been one that they have some hoops to run through in regards to refrigeration of items. So we tend to have like pop up produce types of events once a month. But shelf stable protein items are a very good option for our clinic pantries because you can keep them on the shelf and there's no regulations in regards to whether or not you have to refrigerate or freeze them. So that's been a
Mm.
really nice benefit of us, especially with clinic pantries and hospitals, is that attachment to healthcare gives us also some credibility, and we get to look into the eyes of our medical professionals and have that conversation about healthy, nutritious foods that are available to especially food insecure people.
Mhm. Mhm. Yeah, yeah, I wonder the idea with all this energy behind fruits and vegetables, we have to make sure fruits and vegetables and this eschewment of meat, it's really more of an emotional what seems like the right solution instead of what actually is the right
Yeah.
solution. And I wanted to also comment. I just wrote down culturally appropriate because not only is meat culturally appropriate to most cultures,
Mm,
but also when we're thinking about modern culture and what people like to eat, what are people comforted by, like not
sure.
just from their homeland, but
Yeah.
not just like, or I'm not talking like enchiladas and chicken sog. I'm talking
Yeah.
about like what do people want at the end of the day? When I worked at the Daily Table in Boston, which is a sort of a low income grocery store that was set up almost like a food bank, but they would take kind of close to expiring food and we would sell it
Hmm.
at discount prices. We didn't have a lot of customers initially, and I did a little needs assessment and went to the community health clinics and asked them, why aren't people coming in? We are with brown rice and roasted chicken and some broccoli, and they're not coming in. They're still going to the fast food. And I thought this
Yeah.
was all about just, getting these healthy food options in urban, food deserts. And they said, well, when you've had a bad day, do you want steamed broccoli
Yeah.
and roasted chicken, or do you want to dive into a bowl of pasta or,
Sure.
whatever your comfort food is? And I think there's a certain level of elitism
Yeah.
that goes along with this idea that everyone should just be eating fresh, fruit and vegetable, veggie stir fries with a little tofu.
Sure.
That's possible when you live near a Whole Foods and
Yeah.
you, have the time to cook that up. But that's not what the average person who's struggling might want.
No. And especially in food insecure people too, it what are the options available to them? And then, like you said, what's that source of comfort? So I am always a firm believer in, if no matter where you go to eat, whether that's through the grocery store, at home, or away, you have choices to make. So just be smart about the choices that you make. And I think, again, I'm not saying any restaurant is bad or any grocery store is bad, is you have to have a little bit of that education piece to say, if I am in those places and that's what I want to eat, at least make better choices than going in blind. So it's, forget the French fries, right? Take the bun off of the patty. Like there's some options for you when you make those choices. If it's for comfort, or if it's for convenience, or if it's for cost, um, it really comes down to just being educated as to what are the best options that you have at the moment. Um, a longstanding colleague of mine who's in childcare, we have this ongoing debate about yogurt, um, and serving it to kids and having options of kids. So if you put, a high protein kind of yogurt in front of them, you put a Go-Gurt in front of them, or you put a Snicker bar in front of them, right? and you're at a child care center. What are they going to pick, right? And of course, people think that kids will pick Snickers. And I said, yeah, what about a frozen Go-Gurt? Again, I'm not advocating for Go-Gurt, but it's the packaging, it's the cool stuff that's in there. But I also think the better choice, of course, is the higher protein prior yogurt. But of those choices, if they had to choose, don't choose the bottom one, right? Choose the middle one. It has calcium, you've got some minerals and vitamins, of course,
Mm.
and then move them to the next choice and educate them on why it's important to move to the next one. So it's a process of elimination and education, and I think it has to start certainly with kids, um, as we raise the next generation that will help us live longer, to make those choices and to make the healthier choice. It isn't always about the organic piece of it or the the steamed broccoli. It's make healthy choices and make smart choices, and then work your way into that being a routine habit.
Exactly. So the meat sticks were, something that can, make a big impact. They can go in the kids' backpacks. The the flavors are pretty kid friendly.
Yeah.
Can you talk about, as a director of a food bank, what other types of shelf stable protein are good options, and what do food banks need? Like, if there's someone listening that is like, should I give money? Should I give product or meat or what are some of the challenges that food banks face?
Sure. Certainly shelf stable items are always good for a food bank, especially so we can make sure that we are able to store them for a longer period of time, of course, um, and able to put those into the hands of people no matter where they are. Certainly, refrigerated and frozen proteins, fruits and vegetables are always important. The shelf life again on those fruits and vegetables ends up being it's really tight for us. And so again, they're very important to us, and we always want to make sure that they're in the hands and available to people. But it is a short window. Frozen meats for us is really kind of where we is our sweet spot because we can store them a little bit longer and we can have them available for longer periods of time for our agencies and partners to have. So I would say that we tend to go towards frozen meats because we can keep them for a longer period of time in order
And
for
is
our.
that sorry to interrupt, is that something that most food banks do they have freezers where they can yes. Okay.
It depends on the size of them. We're a pretty decent sized food bank. Our food pantries, we work with our local legislators and we work with donors to provide and purchase refrigerators and freezers for our agencies for those exact types of things. If you're in a church basement, you're not going to have a walk-in freezer. What we do is, can we get you a reach-in freezer? Can we get you an extra refrigerator to store those types of items in smaller community-based ones? There's very few pantries, I would say, that have large walk-in freezers like we do. So we certainly work with all of our agencies to make sure they have the proper refrigeration and freezer storage as possible, and also a good selection of items for them to choose from. Um, as a food bank, we receive food through donated food, through government commodities, and then we purchase food. So those are kind of three ways that we look at food sourcing: is donated food, commodity food, and then purchase food. During the pandemic, we saw a large rise in commodity food coming from the federal government, and we also had to purchase more food because across the United States, pre-pandemic, there were about 34 million people that didn't know where their next meal was coming from. During the pandemic, it was about 53 million people were accessing the food system. So those new people coming into the food system because of the pandemic were we had to supplement with purchased food, um, and I think that that's an important piece of it. Is food banks across the country work daily to make sure that we can raise funds to purchase that food because we want to have balanced food. We can't rely on government food all the time, and then what we do receive from the government, we want to balance with what else do we need to make sure that we have a variety of foods available. We don't have every food, but we have a variety of foods. So, certainly protein is important to us. And again, I had said, our partners look for that across our footprint as almost their number one need because of the expense. And we can store it longer, get it to them in a short period of time, and they can distribute it. During the pandemic, we also saw we could distribute food quickly and easily through drive-through distributions that everybody saw on the news. So that was a great way for us too, because we can straight take it straight from freezer to car and not have to worry about kind of the middleman and dropping it off. So as we move towards the holidays, it's always top of mind. It's that comfort piece that comes to us as people want a turkey at Thanksgiving, right? They want that that large center of the traditional kind of plate filled. So we start sourcing protein. We source protein all of the time, but we have already started sourcing protein for the holidays this coming up. So we've seen those prices double, but we also raise funds to do that, and we help our donors explain that that's an important part of um, anybody's plate for healthy and nutritious balance of their meals. So, I would say we always are sourcing protein and trying to find good sources of protein and every everything that we do.
Just out of curiosity, what percentage of the people that come to you are able to like have cooking facilities? Is the majority? I'm guessing it's the majority, but
I would
and
say
maybe in some other parts of the country they don't. But
sure. And we certainly have intake information again at our markets and our pantries. We have done some distributions, and some of our markets have some of those utensils. So we provide some can openers. We provide some other kind of cooking utensils. Our Healthy Harvest mobile market that goes into 12, or take that back, 10 grocery gaps across our city. We've had cooking classes on there. And once you complete the cooking class in your neighborhood, you walk away with a skillet and utensils to cook. So we try to couple some of the things that we do with some of those utensils or access to those. So, you know, folks that come to us from group homes typically will have a kitchen in that area. We do some homeless boxes, and we're very cautious about what we can give. So that would be, pre-cooked, pre-processed kinds of foods that we need to make sure we get in their hands because they don't have any options for cooking or reheating those types of things. We just launched our prepared meals program, which has been great. So we certainly have a protein source and a vegetable source and a two compartment meal. Just for that reason is we all want convenience. Our customers want convenience too. And if it boils down to it, if you're in an apartment and you have a microwave but you don't have a stove, it's a better option than a canned product for them to pop open. So we're trying to look at how we can flash freeze things, how we can put those into convenience and easily accessible types of items that it doesn't take a lot of work to do. And
or
then
the
we
grip
also,
strength, as we were talking about earlier. So maybe they do have a stove, but they can't
yeah,
actually, use the can opener to open.
yeah.
Yeah.
Absolutely. And then we have a direct program too. We're actually just like a grocery store, we're delivering door to door. So if we can deliver boxes of protein and fruits and vegetables to the door of of people who have no access for transportation or limited access for where they can get to the grocery, that's a door to door service. So many of our deliveries are within 10 or 15 minutes of our facility. And so we can stay within the food safety guidelines for many of our deliveries to get that quickly delivered to a home right on the doorstep. And so it eliminates that transportation and access barrier that is seen in immunocompromised populations, low mobility populations, that I think is somewhat of a game changer for us um, as a food bank.
Yeah. Well, hopefully this has been inspiring. I didn't know that one of the options down the road for a dietitian would be running a food bank. So that's I do have a lot of followers who are in training now, including my podcast editor, who will be listening to this, Emily. So it's noble, it's important, and thank you for the work that you do. And how can people find if they want to? First of all, contribute to you, and secondly, how would they maybe find a food bank in their own area?
Sure. And I would certainly like to mention too that, the last probably 5 to 10 years in the food bank space, it's really been a conversation about health and hunger. It hasn't been about just food insecurity, it's health and
Mm,
hunger and how we kind of wrap our arms around that, and how do we have products and services available to address those issues. So, it's we talk a lot about disease factors. We talk about how we can do meal preparation, how we can do prescribed meals from an insurance perspective. So that whole conversation is very fresh, and it is very ripe for many folks that are coming up the ranks and want to be a dietitian and want to be involved with their food bank, because it isn't just about a warehouse giving out food. It's thoughtful conversations with your medical community and your customers in your community as to how you can do that in the best way. And we need people with that background to help us with the movement of that forward. So there's lots of space in there, and would welcome. And many, many, many food banks have either contracted dietitians, have someone on their board that is a dietitian, and that's a great way to start as well, or just getting involved as a volunteer to look at your backpack program and see if a nutritionist or a dietitian can look at it and say that's a well balanced, well rounded, healthy, nutrient dense type of backpack that we can send home to kids. So I would encourage anybody in the field to just take a look at their local food bank, and you could volunteer with packing events like you participated in and helped feed children, to the board, to being actually a paid staff person. So lots of opportunity out there. Um, so that's great. So in order to get involved, certainly here in Cincinnati, you can go to the freestorefoodbank.org, and there's options for donating and volunteering and getting more involved, as well as finding a local pantry near you. So we have lots of volunteer opportunities at our food bank, and we also have volunteer opportunities at all of our locations that, churches and schools need help also. So anything in your local community. If you're looking for a food bank that's in your area, if you're out in beautiful San Diego, California, don't we wish we all were, or across the country, there is a food bank that in your local area, and we cover the entire United States. So if you go to the Feeding America website, which is feedingamerica.org, you can see all of the locations across the country and be connected with your local food bank.
Well, thank you so much for all the work you do. I'm so honored to be connected with you. I hope to work again, next year with Marcus,
Yeah,
and hopefully we'll make even a bigger impact than we did this year.
I
So
agree.
thanks
Diane, it's
again.
been so great to meet you, and we're so glad you stopped in Cincinnati. And next time it'll be a little bit longer, I hope.
Yes.
And then, so we'll see you soon. And thanks for having me today.
Thank you. Thanks so much for listening today and for following my work. If you believe in making sure people all over the world should have access to nutritious food, please join my mission through my nonprofit, the Global Food Justice Alliance. Visit sustainabledish.com/join and become a sustaining member today. All sustaining members get early access to ad-free podcasts plus free downloads, and you'll be helping get healthy protein like meat, fish, and eggs to food insecure kids. That's sustainabledish.com/join. And thank you.